understand this video will be used by the Chamberlain College of Nursing and has my permission. Come in.
Hi there, my name is Hannah. I'm going to be your nurse today. So today we're going to be doing a catheter insertion and removal, okay?
Okay.
Awesome. Can I go ahead and identify your name and date of birth, also on your wristband?
James Wall, 8/24/94.
Awesome. Thank you. Confirmed on the wristband. Do you have any allergies to latex?
No.
Shellfish?
No.
Iodine?
No.
Chlorhexidine?
No.
Awesome. I'm going to go ahead and pull for privacy, and then I'm going to place my supplies on a clean surface. And then I'm going to wash my hands. So we're doing this today just to keep everything sterile. And so you have a good way to excrete as well. We're removing it just to keep everything sterile, like I said, and prevent any infection or complications. Awesome. And then we're also going to be cleaning your perineal area. Do I have your consent?
Yes.
Okay. Do you have any questions?
No.
Okay. I'm going to go ahead and raise the bed to the level of my hips. And then I'm going to grab the bath blanket and place it over you and pull the top linens to the foot of the bed. Well, you can just hold on to it for me, okay? Great. Okay. Now I'm just going to pull the blanket down just a bit. So just looking, I don't see any bladder distension. I don't see any perineal redness. I don't see any skin breakdown, rashes, or open sores. Yes. Now I'm going to be exposing your genital area. Is that okay?
Yeah.
Okay. And he is already in the supine position. Legs flexed, he's lowered. I'm going to have you just go ahead and move your ankles to the side. And then I'm going to wash my hands. Lower this side rail, which is the working side on the left. And then there is already a waterproof pad underneath him, so that's good. Now I'm going to remove the kit from the bag. Placing the bag at the end of the bed. Now I'm going to open the kit away, side to side, and then towards. Now I'm going to remove a sterile drape from the kit. Place it between the legs of my patient. Okay. And then now I'm going to put on some sterile gloves. So I have my kit. And I did drop the glove, so in a situation I would have gotten a different glove. My right hand will remove sterile through the procedure. I'm going to go ahead and remove the antiseptic solution here, pouring it onto the cotton balls, and then discarding of that solution. I'm going to place the catheter kit between the legs of my patient. The solution is on it, so now I'm going to touch and clean the perineal area, okay?
Okay.
With my non-dominant hand, I'm going to spread the labia majora to expose the meatus. Okay. With my non-dominant hand, with my dominant hand, I'm going to grab a cotton ball. We're going to clean from front to back, grabbing a new cotton ball each time. And then I was able to clean the interior as well. I cleaned along the folds directly over the center of the urinary meatus. And again, I discarded the cotton balls into the bag after each use. Now, I'm going to get the catheter, and with my sterile hand, I'm going to get the catheter itself, holding it 1 to 2 inches, putting some lubricant on it. I'm going to feel some pressure. Now I'm going to guide it in with my sterile hand. Flash of urine was noted. Now advancing it an additional 1 to 2 inches just so it's secure. Now I'm going to fill the balloon. Gently pulling to make sure it's in the proper position. Going to remove my gloves into the trash, discarding the kit in the trash as well. Now I'm going to put on clean gloves, and then my catheter here is falling out, so I'm just going to adjust. Clean gloves were put on though. I'm going to raise the side rail back up. And are you doing okay?
Yeah.
Okay. And then I'm going to secure this to my patient's thigh, attaching the drainage system lower than his bladder, so it'll be on the lower side of the bed. But just for the sake of the video, I can't do that or else it'll fall out. So I'll just let it stay here. Okay. I would go ahead and clean and dry the perineal area thoroughly with gloves on. Now I'm going to be removing the catheter. So first things first, I would move the top linens to the end of the bed. And then I'd let you know that I'm about to be removing the catheter and I will be exposing your genitals again.
Okay.
So I'm going to remove the tape that was secured to his leg into the bag. I would have attached a different syringe to the balloon port, removed any air or fluid, and then I would gently pull while instructing my patient to exhale. And I also have a towel ready in my other hand. Okay, I do not see any blood, mucus, or infection. I'm going to discard this into the appropriate receptacle. Also discarding my gloves. I would wash my hands, put on clean, sterile gloves again, and then I would take, before I like to make a correction, before discarding of the bag, I would have measured the urine, I would have noticed the color, the amount, and then I would have discarded it into the trash. And then I would raise the side rail again, perform some hand hygiene, and then I would clean and dry the perineal area with gloves on if necessary. I would adjust his linens. That is in the lowest and locked position. The call light is within reach, and then I would wash my hands.